put a smile on your face when you're moving from place to place. Good morning, good morning, morning, good morning, morning.
Good morning and welcome back to Youth Wednesdays on Tobago Updates Morning Show. You're viewing us on Tobago Updates Television. And this morning, we're going to take the conversation a bit more serious this morning. We're going to be chatting with Dr. Renae Alfred, no stranger to us, of course, a pediatrician in the Tobago Regional Health Authority. And this morning, the topic is virus prevention among kids and children. So good morning to you.
Good morning. Thank you for
well
having
dressed.
me.
I love your orange.
Thank you.
All right, doctor. All right, take care. But for those who don't know who you are and what you do, just quickly share.
Okay, good morning again, viewers. Thank you so much for having me. My name is Dr. Renae Alfred. I am a general pediatrician. I currently work at the Scarborough General Hospital, and I just moved back home. Well, not just, a few years ago, about 2 or 3 years ago. So I'm here now, and this morning I just want to share a little insight about all the pesky viruses that are going around that are really causing parents a lot of stress and strain, just to give some insight on what to do, how to prevent it, and things you could do at home and when to seek medical advice.
All right. So tell us about viruses. I know that viruses is one of the smallest microorganisms in the in the microorganism world. They're a lot smaller than bacteria. So tell us a bit more about viruses and how do they work and affect the body.
I would say that viruses, in my opinion, are smarter than bacteria. They're much more troublesome than bacteria, and there are less treatments available for them than bacteria. So that in of itself causes a lot of trouble. The best way to deal with viruses is to develop antibodies. And the only way you can do that is foolproof, or probably nothing is foolproof, but is closer to 100%, would be to experience the virus itself.
Right.
So a child that is going through a virus will develop antibodies. Most children will be able to clear most viruses on their own with just their immune system, once their immune system is competent or they're healthy all around. Right. But there are cases where, because the child is smaller or has not been exposed to viruses prior to that experience, they're going to get more sick than we anticipate and even have to be hospitalized.
Yes. So that brings us to the most important factor in preparing children for viruses, the immune system.
Right.
How do we ensure that a child's immune system is ready for a virus? Because you talked about antibodies and producing antibodies in mitigating against viruses.
Yeah.
So just to share about that.
Okay. So the first thing we have to know is what is normal. Okay, so a small child who is less than 5 years old, so this is a preschool child, will have a virus every 4 to 6 weeks.
Really?
Right? Yes, and that is normal. So when parents say that, I feel like they just got over this virus and they're coughing again, or we just dealt with fever last month and this month their nose is running, I'm so sorry, but that is actually normal for them.
It is normal.
Yeah, so when children are in preschool, it's not uncommon to pick up your child from school and realize that somebody's sneezing, or somebody has a runny nose, or somebody's coughing, or there was a child that was absent for 2 days and then it's back in the school system. So that is normal for that age group. So if you have up to 10 viruses per year, less than age 5, that's normal, right?
Okay.
Between age 5 and a bit older, so school age, we will call about 7, 8. It's going to go down to probably about 6 to 8 viruses per year, right? And then when they get older, it's probably about 3, 4 viruses per year. And by the time you're an adult, you really only get sick twice, per year, right? Because with every exposure, you develop antibodies, and they're going to be able to fight against the next time you get that virus. So it's not that you will never get that virus again. It's that your body is going to deal with it faster and faster every time, because your antibody response will be higher and higher. The response is going to mount higher and higher with every exposure. The thing is about viruses is that they also mutate. So, influenza virus is a good example. So this year, the receptors on the outside, or the way we tag the viruses on the outside, look a certain way, and you develop antibodies to that. But by the next year, the virus has become smart and decided, well, I'm going to change a few things. So your antibodies will pick it up, but not as fast, because there is something about it that's different. And that's why you have a flu shot every year, because influenza virus in particular is very annoying in that sense, right? And it loves humans. There are different subtypes of influenza, and some of them, are always attacking humans. So the first thing to know is what is normal, right? Then the next thing will be how to boost your immune system. Parents will always ask me, do I need to give my child multivitamins? And my response to that is no. If you have a child who is a good eater, so they eat from all the food groups, they are good with green leafy vegetables, they're good with their fruits and all the different colors, and they have a rainbow diet, which, as the name implies, is colorful, right? They will get all the micronutrients and the vitamins and minerals that they need. The best way to get micronutrients is through your diet. It will never, multivitamins that you take will never give you as much as if you eat it, right? So if your child has a good diet, and you're able to provide that, because that's the next thing, we're all working, finances are hard for everybody.
And just to place some emphasis on the diet, just for parents who may not know, just highlight some of the different food groups, and quickly their importance.
Okay, so your major food groups that everybody knows about will be your carbohydrates and protein. You could go online; it's widely available. There is the My Plate picture there that you see that you have carbohydrates and proteins, which will make up a quarter and a quarter, so half of your plate. And then the next part of your plate is supposed to be vegetables, fruits and vegetables, right? So that's not how we eat. We eat carbohydrates half, protein
a little bit,
and then fruits and vegetables like a very small portion. But that's not appropriate, right? So for your child, you're going to try your best to give at least 1 to 2 portions of fruits and vegetables every day, and this is different colors. So, some children like certain things. I would advise parents, use what is in season, use what's available to you. Don't try to go and get all those expensive kiwi and things that are not produced here and have fertilizers and additions to them. Use what is local. Start from early so your child develops the taste of fruits and vegetables and doesn't mind them by the time they get big. So you're going to get your micronutrients there, so you don't need additional vitamins. If you do have a child that is a picky eater, or you're very, very busy, or, you have demands on your life that you're not always able to get that container with the fruits and vegetables. You're feeding them, but it's not going to be ideal every day. Then I would say if you do have to get a multivitamin, something with vitamin C, vitamin D, zinc is good for immune boosting, right? And then, of course, prevention in terms of always teaching your hands, wash your hands, wash your hands, wash your hands, wash your hands. Always teach them, wash your hands before and after using the bathroom. If you're in a general space, go and wash your hands. Children love to touch everything and they love to hug each other and they love to be in each other's space. And so it has to be put on the level of the child, right? I'm not going to tell a 5-year-old, but don't hug anybody. Doesn't make sense. But try to wash your hands. If they are in a preschool, some preschools will ask for wipes and cleaning solutions to help wipe down tables and those kind of things. So you try to provide it for the child. You try to wipe down your surfaces at home. Those are the things that you can do for prevention.
Thank you. And, just while we're speaking about viruses, what are some of the common viruses, especially now? I mean, we had some 10 years ago in my time, in your time, they were different. What are some of the common viruses that are prevalent now that you see are affecting kids in your field?
So the viruses that were common in our time are still the same viruses now.
Okay.
And that's another thing about them. They can last centuries, right? They may go into a period of dormancy, but they can last centuries.
Oh,
So,
how we could have lasted like viruses
well, yes.
and mutate like them too.
Well, yes, if we were as smart as them. So, just generally, stomach bugs, the number one stomach bug, the most common is called rotavirus. There are many others, but rotavirus is the most common one. It is the one that we actually have a vaccine against. So children can get rotavirus shots. It should be given before they are, I think the last one is 6 to 8 months. You have to be given before that time. And they have to be given about a month apart. The thing is with rotavirus, the vaccine is that there are some precautions that have to be taken. So you could speak to your pediatrician about that. In terms of your respiratory symptoms, there is adenovirus, there is rhinovirus, and there is respiratory syncytial virus. Those are the most common ones, as well as influenza virus, as we said. Adenovirus is also very pesky in that it causes respiratory symptoms, but it could also get sinusitis, runny nose, itchy eyes, pink eyes. It could also cause issues with your tummy and your urinary tract. So that one is
Wow.
crosses many systems.
I see.
So those are the top ones that we're going to get variable progression, as well as variable mutations, as well as variable incidence with.
Right. And during the COVID period, it would have forced us to vaccinate, make vaccination mandatory as a mitigative measure against that virus. You know, and growing up, I know that, and you alluded to it earlier, we had to take shots as kids.
Yeah.
For some reason, it seemed as if this COVID period would have made some people more sensitive to giving their children shots. What would you say to a parent who is hesitant and fearful that they give my child flu shots, they might kill me pitney?
Yeah.
What would you say to a parent, about the importance of being immunized?
Right. Okay. So what I would say to the parent is, one, educate yourself. A lot of parents will say, well, I heard this and I heard that, and somebody told me this happened to their relative, but a lot of it is not based on fact, right? And a lot of the things that are out there are not based on fact. They're based on panic and people having one instance, or not any instance at all, but just spreading propaganda. Educate yourself. This is your child. I'm very big on making sure that parents know what I'm vaccinating their child against. You shouldn't be going, we did that before, but now we know better, right? You shouldn't be going to the health center at this point and you have no idea what your child is being vaccinated against, right? We get over 40 vaccines in your lifetime. We start vaccination in this country as early as age 6 to 8 weeks of life. That means your newborn baby. So you need to know, you need to ask, what am I getting at 2, 4, 6 months? What am I getting at 12 months? Ask. The nurse will be very, very knowledgeable, because this is something that's going on for years. So ask. The next thing is vaccines were developed because there was a time that viruses caused dramatic drops in populations, right? They killed children and they killed adults. So even the vaccine your child gets at 2, 4, and 6 months, something like pertussis or whooping cough, back in the day, that was a deadly virus, right? Now you very rarely see it. And we usually see it where there's vaccine pockets, right? So you educate yourself. You know that the vaccines are based on sound science, and this is something that's going on for tens of hundreds of years now, vaccination. And then the next thing is also think about your community. There is something called herd immunity, where once the large majority
Yes,
of persons are
everybody else is
vaccinated,
immunized in a
then
sense.
then the viruses cannot get in. It does not mean that they're dormant, and it does not mean that they're non-existent. It means that everybody has so many antibodies against this particular virus that there are few people getting sick or getting the virus to replicate in their body at such an amount that it's spreadable, right? So, case in point, in Venezuela, just in, I believe in the 1999 it was, they had, because of the social unrest, they had a period where there was a very low vaccination rate. People just weren't going or weren't getting out to get their children vaccinated. And they had a surge in yellow fever, right? And in measles, mumps, and rubella, to the point where now we locally have to change our vaccination schedule. So whereas we used to give that second shot for yellow fever and MMR later on, we now have to bring that up to age 2. Mm-hmm. So you would find that how you were vaccinated, your child is now getting a different regime, and it's because of how close they are to us, because of migration, and because of the fact that they had a low vaccination rate. So I encourage parents. I really would prefer that people would come and ask questions than have a preconceived notion in their head, and then they don't discuss it, and we get false information out there.
I want to thank you so much for coming. I mean, we could talk all day about vaccines and how we prepare the population, especially our young children, for vaccination. I want to thank Dr. Alfred for coming on this morning. I want to thank you for listening. We'll go over to Luke for his segment. Up next, we have the barber. Let me just get his name quickly. Mr. Denary McNichols. We have him next, and Mr. Luke Trim will be taking on that interview. So thank you for joining us again, and remember to share the live, share the live, share the live.